Hey everyone, it's Nurse Sarah, and in this video, I want to do a quick review over all the antibiotic classes that you need to know. So let's get started. The penicillin class has a common suffix known as cillin, C-I-L-L-I-N, and some popular ones in this class include penicillin and amoxicillin. Now, what do they target and treat? Well, they primarily target gram-positive bacteria, and how I remember that is that penicillin starts with P, that's telling me we're dealing with positive. Now, on the flip side, they do target some gram-negative bacteria, especially those broader spectrum types like amoxicillin. So because of that, they're really helpful in helping us treat strep throat infections, STIs such as syphilis, and ear infections. Now, how do they work? Well, what they do is that they inhibit bacterial cell wall synthesis. So they have a bactericidal effect on the body to go after those bacteria. Now, what are the things that you must remember about this class? Well, to help you remember those things, remember the abbreviation for penicillins, PCNS. P is for penicillin allergy common. So this antibiotic class has the most common antibiotic allergy. So you always want to ask your patient if they're allergic to this, and you want to monitor them for like rash, hives, and anaphylaxis. C is for cross sensitivity with cephalosporins. So if your patient reacts to penicillins, they may also be allergic to cephalosporins. N is for nausea. So this class can definitely cause GI upset. And if this occurs, you can educate the patient that they can take some food because hopefully that can help alleviate that. However, some medications in this class are better to be taken on an empty stomach because it really promotes absorption of the medication. And then lastly, super infection. So you want to watch for C. diff. This will present as frequent, watery, foul-smelling diarrhea. And they can also experience oral thrush and vaginal yeast infections. The cephalosporin class, it has a common prefix of ceph. So it can be spelled either like CEF or CEPH. And some popular ones in this class include like ceftriaxone or cephalexin. Now, what do they target? They have a broad spectrum reach, so they primarily go after gram-positive, especially those first generations of cephalosporins, but they have increased gram-negative coverage in those later generations. So it makes them great at treating like pneumonia, urinary tract infections, skin infections, being used pre-op before a patient has surgery, and it can even treat some central nervous system infections like meningitis, because some of those later generations actually can cross the blood-brain barrier. So how do they do this? Well, they actually inhibit bacterial cell wall synthesis, so they have a bactericidal effect on the body. Now, what are those things you must remember about this class? Well, look at that word cephalosporin and that first part of the word cephala, and that's what we need to know. So C is for creatinine, BUN. Monitor those kidneys because this medication class can be nephrotoxic. E is for alcohol intolerance, so no alcohol with this class because there is a risk of a disulfiram-like reaction. So you want to avoid alcohol during and even up to 72 hours after treatment, depending on which medication we're talking about in this class. Next is pseudomembranous colitis. This is associated with a C. diff infection and it presents with watery, foul-smelling diarrhea and fever. Hypersensitivity, so you want to ask about a penicillin allergy if the patient has it because there is a cross sensitivity with this, and you want to look for rash or any anaphylaxis. Also, you want to be aware of the administration of this. So if you're giving it IV, you want to watch out for phlebitis because it's hard on the veins. And then if you're giving it IM via an injection, you want to use a large muscle like the ventrogluteal route. And then lastly, L, lower prothrombin. So some medications in this class can actually interfere with vitamin K, and this could cause bleeding. So you want to monitor their PT-INR. The aminoglycoside class has a common suffix of mycin, which could be spelled as MYCIN or MICIN. And some medications in this class include gentamicin or tobramycin. Now, it targets primarily gram-negative, so that makes it good at treating cases of sepsis and respiratory and intra-abdominal infections. Now, one thing I want to point out is that this medication is usually given IV or IM because it's not really absorbed very well orally. Now, one medication in this class that is given orally is neomycin. And the reason for this is because it's for gut decontamination. So if a patient is having, let's say, surgery on their abdomen, they may give them this because in a sense it can help do like some GI sterilization so we don't get an infection afterwards. or it can be used in cases of hepatic encephalopathy, which in a very condensed, summarized way is that this is where your liver is not working, so you have the buildup of toxins. And one of those toxins is ammonia. And we can give them this medication, which can help decrease that substance in the gut. Now, how overall does this group work? Well, it inhibits protein synthesis by targeting specifically a part of that ribosomal subunit known as 30S. So it has a bactericidal effect on the body. Now, what must you remember about this class? Well, remember the word amino, which is the first part of this class's name, aminoglycosides. A is for assess the peak and trough. So this medication has a very narrow therapeutic range. So with the peak, this is where we have the highest concentration in our body. So we would want to measure this about 30 minutes after the IV form or 1 hour after the IM dose. And for the trough, this is the lowest concentration in the body. So we would measure this right before the next dose. Also, you want to monitor kidney function because this medication class is nephrotoxic. So you want to check that creatinine, BUN, watch their I's and O's. And then IV or IM is usually the only route given because, again, it was not absorbed very well orally except for that neomycin. N is for neuromuscular blockade, so watch for muscle weakness or respiratory failure. And this can actually be worse if your patient has a neuromuscular disorder like myasthenia gravis. And then lastly, O for ototoxicity. We're talking about the ears here. So there's a risk with this. So look for ringing in the ears, hearing loss, balance issues, and this actually increases whenever you have a high trough level or the patient's been getting this for quite a while. The fluoroquinolones class has a common suffix of floxacin, which is spelled Floxacin. And this includes like ciprofloxacin and levofloxacin. Now, whenever we're talking about targeting, it has a broad spectrum coverage. So it really goes after those gram-negative and some gram-positive. Therefore, it's really good at treating urinary tract infections, respiratory, GI, and skin infections. But how does it do this? Well, what it does is it inhibits DNA gyrase, particularly the ones that go after gram-negative, and topoisomerase 4, the ones that are the gram-positive. And all this is really going to block DNA replication. So it's going to have a bactericidal effect. So remember the word floxacin to help you remember those things about this class. F is for fluid intake is key, especially with Cipro. So you want the patient to drink plenty of water to prevent crystalluria, which could lead to kidney injury. It can also cause a long QT interval. So if the patient is also taking this along with other QT prolonging drugs like amiodarone, there's definitely a risk for this. So monitor their ECG. And older adults are at risk for tendon rupture, particularly the Achilles heel. And this risk is increased if they're also taking corticosteroids. So tell the patient to report immediately any pain in this area, swelling, or a snap feeling, or they have a decrease in their immobility. And patients don't want to take this with antacids, calcium, iron, or dairy because it reduces absorption. Also, you want to avoid in children and during pregnancy because in children it can actually cause bone and cartilage problems. And there's a C. diff risk with this, like with many of these antibiotics. And there's increased sun sensitivity, so tell the patient when they go outside they definitely need to wear sunscreen and to avoid tanning booths. And lastly, it can have neuro effects, especially in elderly patients, which can manifest as dizziness, headache, and confusion. The macrolides has a common suffix of thromycin, which is spelled Thromycin, and includes medications like azithromycin and erythromycin. Now, as a side note, whenever we're talking about these common prefixes and suffixes, make sure you're looking at that whole prefix or suffix, because sometimes some people, when they glance at this name, they see the mycin and that's all they look at and they think, oh, this is an aminoglycoside, because those medications tend to end in this, but it's not. Look more at that suffix. Particularly for this one, you can look at that RO, the rho. Where else are you hearing that rho at? In macro. So that hopefully can help you see the difference between those and you don't get confused. Now, what does this group mainly target? Well, it primarily targets gram-positive, but it can go after some gram-negative, and that makes it really good at treating respiratory infections, STIs, particularly chlamydia. Have a whole lecture on chlamydia if you want to check that out up there, and H. pylori and ear infections. So how does it work? What does it do? Well, it inhibits protein synthesis by targeting a particular part of the ribosomal subunit, which is 50S. So it has a bacteriostatic effect on our body. Now remember the word lides to help you remember those main things for this class. So L is for liver toxic. You want to monitor the patient's liver enzymes, especially with long-term use. It can also increase the QT interval, so there is a risk, especially if they are using other QT prolonging drugs like, for instance, like amiodarone. You can increase the risk of arrhythmias. And you also want to check their ECG, make sure we're not prolonging that QT interval. It also has a lot of drug interactions, especially when we're talking about the macrolides like erythromycin and clarithromycin, because these are CYP450 inhibitors, which can cause other drugs to become toxic like warfarin, statins, and theophylline. The patient wants to eat food when taking these because it'll help reduce GI upset, unless, of course, they're directed otherwise. And then lastly, there is that risk of super infections, which you're going to see that a lot with these antibiotic classes. So again, watch out for C. diff, that thrush, especially in the oral cavity, and vaginal yeast infections. The sulfonamides class has a common prefix of sulfa, S-U-L-F-A, and it includes medications such as sulfamethoxazole and trimethoprim, which is a combination drug, and we know it mainly as the brand name Bactrim, and then sulfadiazine. Now, it targets a broad spectrum. So it goes after gram-positive and gram-negative, but it also can go after some protozoal infections. So it can be used to treat urinary tract infections, MRSA, bowel, ear, lung infections, and those parasitic infections, such as toxoplasmosis. Now, how does it do this? Well, it's very interesting because it actually inhibits folic acid synthesis. So it has a bacteriostatic effect on the body. And you want to remember this particularly because whenever we're going over those things to remember, folic acid is very important in some of our teaching. You want to remember the word sulfa to help you remember those important concepts. S is for sensitivity to sulfa and sun. Patients can have allergic reactions with this class. It's actually quite common. And some of these patients can actually progress to a condition known as Stevens-Johnson syndrome. And this is where they have from like their head to toe major inflammation, their skin is literally peeling off and blistering, and I have seen this in a patient and it is very, very uncomfortable and just a horrible thing. So you want to look for that. Also, it can cause the skin to be photosensitive, meaning the sun can irritate the skin, so you want to educate them to use sunscreen when going outside and to absolutely avoid tanning booths. And you want to use caution with other meds whenever they're taking this class because it can actually increase the effects of other medications like warfarin. It can increase bleeding risk by raising the INR. Phenytonin, it can increase neurotoxicity. And with sulfonylureas, it can increase the risk of hypoglycemia. So with a catch-all, you want to monitor labs, especially INR, blood glucose, and for those signs of toxicity. It can also have an effect on the liver by being liver toxic. It can cause the liver enzymes to elevate, so monitor those LFTs, especially if they're using this long term. Then another thing I want you to remember is about folic acid synthesis being blocked. So typically this class is avoided during pregnancy, especially during the first and third trimester. And the reason for this is during that first trimester, there's a lot of development going on. So there's a risk of birth defects or megaloblastic anemia. And this stems from how folic acid is being blocked at synthesis. And then the third trimester, a condition that can be experienced by the fetus is called kernicterus. And this is where the baby starts to experience high levels of unconjugated bilirubin, which over time will affect that neurosystem and damage the brain. In addition, this class is also avoided in patients who have folate deficiency because it can lead to that megaloblastic anemia. So look at your patient's history. For instance, let's say your patient has chronic alcohol use. Well, you probably don't want to use one of these medications because they're already at risk for nutrient deficiencies, with one of those definitely being folic acid. Plus, they can have liver impairment, and that ties back to the other part of the mnemonic we just went over. And then lastly, the patient wants adequate fluid intake while they're taking this class because that helps prevent crystalluria, which whenever you form crystals in the urine, that can damage our kidneys. So you want to educate the patient to drink at least 2 liters of fluid per day while taking this medication, unless of course it's contraindicated, and you want to monitor urinary output and their renal labs like BUN and creatinine. The tetracyclines class, it has a common suffix of cycline, which is C-Y-C-L-I-N-E. And medications in this class include like doxycycline and tetracycline. Now, what does it target? It has a broad spectrum, so it can go after gram-positive, gram-negative, along with some protozoal infections. So it's really helpful at treating acne, some STIs like chlamydia and syphilis, also Lyme's disease, Rocky Mountain spotted fever, prevention of malaria, and respiratory infections. Now, how does it work? Well, what it does is it's going to go in there and it's going to inhibit bacterial protein synthesis by specifically targeting a ribosomal subunit known as 30S. So it has a bacteriostatic effect. Now, to help you remember those important concepts about this class, remember the word tetra. So T is for teratogenic. You want to avoid this class during pregnancy because it can actually harm fetal development of the bone and the teeth. Also tell the patient to take these on an empty stomach with a full glass of water. And they don't want to take these with dairy, antacids, iron, or anything like that because it can block the absorption of these medications. And when they take them, they want to take them in the upright position and to set up for at least 30 minutes after the dose, especially when they're taking doxycycline because it can irritate the esophagus and cause esophagitis. There's also a risk of photosensitivity with this class. So it increases their risk of a sunburn. Teach them sun protection like sunscreen when going out, wearing hats, and using no tanning booths. And then lastly, avoid this class in kids less than 8 years of age because it can actually slow their bone growth, which is a crucial time when that body's growing, and it can discolor teeth that are developing. The glycopeptide class actually doesn't have a common prefix or suffix, and a popular medication in this class is vancomycin. Now, whenever you look at this medication, don't get confused and think it's an aminoglycoside because remember that class tends to end in mycin, like M-Y-C-I-N or M-I-C-I-N. However, this is not it. Look more at this name a little bit. Look at that co in there. Where else have you seen co at? In its main class name, glyco. So this is a glycopeptide. Now, what does it target? It targets gram-positive like MRSA and C. diff. So what's it going to treat? It's going to treat those two along with bone infections, pneumonia, and endocarditis. So how does it do this? Well, it works to inhibit bacterial cell wall synthesis. So it has a bactericidal effect. Now, to help you remember the important concepts about this class, particularly vancomycin, I want you to remember the word vanco. Vancomycin is very toxic. It has a narrow therapeutic range. So we are going to draw trough levels, see where our patient's at, and you want to draw the trough before the 4th dose with a goal of it being about 10 to 20 micrograms per milliliter. Also, you want to administer this very slowly IV over more than 60 minutes because we want to prevent a non-allergic reaction, and this is where the patient will start to have flushing, rash, and hypotension. It's also nephrotoxic, so it can hurt the kidneys. You want to monitor BUN and creatinine. Now, when vanco is being used to treat C. diff, you want to remember that you're going to be giving them the oral form of this because that medication is going to go in the GI tract, which is where our bug is hanging out. The IV form doesn't really treat it. And then lastly, O for ototoxicity. It can harm the hearing, so monitor the patient for ringing in the ears, hearing loss, and vertigo. The carbapenem class has a common suffix of penem, which is P-E-N-E-M, and includes imipenem and meropenem. Now, what does it target? Well, it has one of the broadest spectrums that it can go after. This is very tough stuff. It can go after gram-positive, gram-negative, anaerobes, and ESBL, which stands for extended spectrum beta-lactamase producing bacteria. So we use this to treat serious resistant infections. So it's like our go-to when everything else has failed. So it's our final line. Now, how does it work? Well, it inhibits bacterial cell wall synthesis. So it has a bactericidal effect. So because this is one of our final line antibiotics, I want you to remember the word final to help you remember those key concepts. So F is for resistant infections. Again, it's used when other antibiotics fail, but we don't want to overuse it because we want to present resistance. We need it when we need it. I is for IV or IM route. So your patients who are going to get this, they're going to be extremely sick. They're going to be hospitalized. So of course they're going to be getting an IV. There's no oral options available at this time. There's also a neuro risk for seizures, especially with imipenem. So you want to assess for seizure history, what's your patient's neuro status. And there's allergy potential due to its beta-lactam structure. There's a possible cross reaction with penicillins and those cephalosporins. So ask about an allergy. And then lastly, labs for kidney function. So monitor creatinine, BUN, and isonos. And again, monitoring renal function is really a big thing with a lot of antibiotic classes. So always just look at that and remember that in your memory. The lincosamide class actually doesn't have a common prefix or suffix, but a popular one used is clindamycin. Now, as a side note, I want to point out that some people may get this confused with it and think it's a aminoglycoside because it ends in the mycin. However, take more of a look at this med name. It has a lin in there. It's that clin, and you see the L-I-N. Well, that should tip you off that it's part of the lincosamide. So hopefully that helps you keep them separate. Now, what does it target? It targets mainly gram-positive and anaerobes. It does not target gram-negative aerobes. So it makes it good at treating MRSA skin infections and dental infections. Now, how does it work? How does it knock out these things? Well, it inhibits protein synthesis, mainly by targeting that ribosomal subunit 50S. Now, depending on the dose of this class, it can either have a bacteriostatic or a bactericidal effect. Now, to help you remember those important concepts about this class, remember the word linco. L is for liver toxicity. So this class can be pretty hard on the liver, especially with prolonged use. It's given IV, PO, and topical routes. Whenever a patient takes it PO, they want to take it with a full glass of water to prevent esophageal irritation. Nausea and vomiting can occur, so taking this with food can potentially reduce those signs and symptoms. And a big thing I want you to remember is that with clindamycin, there is a huge risk with a C. diff infection. So you want to make sure you're monitoring the patient for diarrhea that's watery, frequent, and has a very foul odor to it. If they have that, get a sample and send it to the lab. And then lastly, O, this medication class is an option for penicillin allergic patients. The oxazolidinones has a common suffix of zolid, Z-O-L-I-D. This includes linezolid and tadizolid. Now, what does it target? It only targets gram-positive, such as MRSA and VRE. So it's really helpful in treating those complicated infections of the skin, the bloodstream, and the lungs, like with pneumonia. Now, how does it work? Well, it inhibits protein synthesis by targeting the 50S ribosomal subunit. So it's going to have a bacteriostatic effect. Now, to help you remember the important concepts about this class, remember the word zolid. So Z is for ZAP's bone marrow. Unfortunately, this class carries the risk of myelosuppression, where we will see a decrease in white blood count, platelets, and red blood count. So we want to monitor the patient's CBC closely, especially if this is used for more than 2 weeks. O is for oral equals the IV. So this medication class has excellent oral bioavailability, allowing the oral dose to actually equal the IV dose. You want to look for neuropathy. There is a risk of peripheral and optic neuropathy with long-term use greater than about 28 days. So assess their vision and their sensation. It can also interact with serotonin meds, so you want to avoid SSRIs, SNRIs, and MAOIs because we can experience serotonin syndrome. And if this develops, you'll see fever, sweating, tachycardia, and hyperreflexia and tremors in your patient. And then lastly, you don't want your patient eating tyramine-rich foods because it acts as a weak MAOI. So you want them to avoid aged cheese, cured meats, and fermented foods, because we could have a hypertensive crisis. The nitroimidazoles class shares a common suffix of dazole, D-A-Z-O-L-E. This includes like metronidazole. Now, how does it work? What does it target? Well, it targets those anaerobic bacteria, such as gram-negative and some gram-positive, along with protozoa. So because of that, it's really good at treating C. diff, along with an STI known as trichomoniasis and giardiasis. So how it works is it's going to damage the anaerobic organism's DNA, so it has a bactericidal effect. Now, to help you remember those important concepts about this class, remember dissolve. So D is for disulfiram-like reactions. So while they're taking this, no alcohol during or for 3 days after, because it can cause flushing, vomiting, headache, and hypotension. They want to avoid this in the first trimester, so avoid it in early pregnancy unless absolutely necessary. And if they do take it during pregnancy at any other time, they want to use with caution. It's going to zap those anaerobes in the protozoa. It's given orally, IV, topical, or vaginal routes. The route depends on the infection and the severity. It can leave a metallic taste or cause GI upset. Those are common side effects, along with nausea, dry mouth, and dark urine. And you want to evaluate for neurosymptoms. It's rare, but there's a risk of seizures and neuropathy with long-term use or high-dose use. Okay, so that wraps up this review. If you'd like to watch more videos in this series, you can access the link in the description below.